What's up guys, welcome back to my channel. My name is Jett and I'm a registered nurse here to share tips and tricks about how to be a nurse. If you haven't already, go ahead and like this video, subscribe to my channel, and comment below. Okay, so today's video, something a little bit more serious, but I wanted to make it lighthearted. So today's video is going to be about how to give a decent report. If you're not a nurse and you're just watching this for fun, basically report is your story about the patient that you give to the oncoming nurse who's about to take over your patient, take over the care for your patient. And we usually fill out a little sheet, kind of just as a cheat sheet for what you're gonna say to that nurse. So just a disclaimer, I am at nowhere a pro at giving report. I do believe I've gotten a lot better at it, and I just want to give some tips because this is one of the hardest things I felt as a new grad, is conquering giving report. It seems so scary. I don't really know what it is. Maybe because you're interacting and trying to show all that you know about the patient to another nurse, and maybe that nurse has been a nurse for years and years, and you kind of in your head are like, oh my God, like this nurse knows so much. Like, I don't know if I sound like a newbie. I don't know if I sound like I don't know what I'm talking about. I think that's why it's so scary, but you will conquer it. I felt like after probably a month of being on my own with no preceptor, I got a lot better at it. Giving report is something that really comes with time. You're not gonna be a pro at it at first. I know I'm not. And also, you're gonna realize some nurses want a very to the point, succinct report, just the basics about the patient, you know, their code status, anything that happened to them recently in the hospital, something serious like a code or a rapid response. Some nurses don't want to know about the cholecystectomy that patient had like 10 years ago. They don't want to know about the tonsillitis, but some nurses do. They want to know everything about the patient's history. So you're kind of just going to learn as you give report to each of these nurses. You're going to learn their styles, and that's hard to do at first. Like, you don't know what the nurses they want to know. So my advice is just give your best report, give all of the information. If the nurse stops you and says, oh, that's okay, I don't need to know that, then you go to the next point on your report. So let's get started. So this is a report sheet. People also call it a nurse brain. It's basically your cheat sheet, and I hold on to this all night. You're constantly adding things to it, and I'll explain some tips on that as well, but don't lose this. If you lose your nurse brain, I'm so sorry, girl or guy. This has all your information on it. So hold on to this real tight. I put it in my foldable clipboard and just hold on to it the whole shift. So on my unit, the nurse to patient ratio is 1:4. So I get 4 of these. When I come to my unit, I find out my assignment for that night, and then I go ahead and I fill stuff out. This is the specific report sheet for my unit. It looks like this. And everyone's is different. Some people make their own. I've tried that, it didn't work for me. I like this, it's just super simple, and hopefully your unit has one pre-made as well. Also, I apologize if I'm very jittery. I've definitely had some coffee today, but it's my day off, so I'm gonna do it, you know? Okay, so you finished your shift, well, you're about to finish your shift, and you're looking for your nurse. You're gonna give that nurse report on your patient. So you're gonna have your whole nurse brain with you. You're gonna have filled it out during your shift. Whatever the nurse that gave you a report, you're gonna have what they told you about the patient, and then you're also gonna have the information that you've looked up during the night or day. Include anything that happened to the patient during your shift. So I like to write down anything, like did they have a bowel movement? Was there a rapid response? Did we increase the oxygen? Or you're just gonna write that down so you don't forget to say that during a report. So you found your nurse. And now you're gonna go to the bedside and you're gonna give report on this patient. You're gonna start with the room number, the patient's name, age, gender, admission date, code status, and allergies. So what I just explained is all in this top corner right here. Room number, admission date, patient name, birthday, or age, and gender. This will all be on this patient sticker right here. Then the code status and allergies. I would say these are like 5 most important things that you can say at first about the patient. And then next would be diagnosis. So then I go ahead and explain where they came from. So this is important. If the patient came from home, patient came from a skilled nursing facility. If they came from home, you're gonna wanna say who they live with, if it's a family member or not, or if they live alone. Over here, you're gonna explain too if they're in isolation, so if they're a C-word patient, or if they say if they're contact or droplet. And then you're gonna say their diagnosis and what they're here for. So say if the patient's diagnosis is sepsis, you're gonna say, okay, so the patient's diagnosis is sepsis. Basically what happened was the patient was at home, and this is just an example. The patient was at home feeling weak, feverish, and they felt dizzy, so they went ahead and called 911 or something like that. That will be in this next box right here, diagnosis and chief complaint, which I just explained. Next important thing is going to be background and history. And like I said before, this is kind of where you can pick and choose what you want to explain. If you're new, I would say everything about the patient. This just depends on the nurse you're giving a report to. If the patient came in for something with problems related to the heart, that nurse is going to want to know what history they have related to heart. So CAD, CHF, and then other nurses are going to want to know everything. They're going to want to know about that tonsillectomy 10, what? I guess if they're 80, then 40 years ago, or whatever. It's gonna be right here in the background and history. Then I go ahead and explain the doctor consult. So this first one right here is gonna be the primary physician taking care of them. I also wanna explain other doctors that are covering for that doctor. And then I'm gonna explain any consults that they have. If the patient is a cardiac patient, then they probably had a cardiologist come and see them. So I'm gonna say, okay, Dr. So-and-so, the cardiologist saw them. You also wanna explain any consults that are pending. You just wanna say any plans of anyone else seeing the patient. Then I go into the assessment. So this is gonna be the assessment that the nurse that gave you a report said, and then also anything that you saw or any changes about it. You're gonna say right here, neuro, which is A&O times 1, 2, 3, or 4. Next is cardiac, so you're gonna explain their rhythm. So if you're on a cardiac floor, then you can look at their telemetry monitor and see what their rhythm is. So sinus rhythm, AFib. If they are AFib, then you're gonna wanna say, is it controlled? Then it's respiratory, so that's gonna be if the patient's on oxygen, how much oxygen, which form of oxygen are they on, is it the nasal cannula, is it the high flow, and then what they're saturating at. So if the patient's on 2 liters nasal cannula, you're gonna say what oxygen saturation you saw the patient at. So they're satting at 97% on 2 liters. And then in this section, I also say if the patient's coughing, if the patient has breathing treatments. Next is GI, so gastrointestinal. You're gonna say the diet that the patient's on, so that usually comes from the chart. Especially if they're a stroke patient or they have trouble eating, you're gonna wanna say, oh, the patient's on like a D3 or like a pureed diet, and they can only have pills crushed in applesauce. Make sure you say that, because you would not want the next nurse to try to give the patient food or a pill and then they aspirate, and then that's a whole nother situation. And then last, bowel movement. So that's important too, especially with elderly patients or patients on pain meds. You're gonna wanna explain when their last bowel movement was, because you don't want your patient to be constipated, possibly have a fecal impaction, or the patient's having diarrhea and you wanna be concerned maybe they have C. diff. Next, the urinary system, which is right here. So this is where you explain if the patient is continent or not of bladder, as well as bowels up here. Then there's a spot for Foley and then the date insertion. So you would explain, okay, the patient is continent of urine, they can use the urinal, or say if they're not, then are they on like a PureWick or a condom cath? If they have a Foley catheter, you're gonna wanna say when it was inserted and for what reason. So bladder obstruction, urinary retention are just common ones. You wanna say is it nurse to manage or a doctor to manage? Because if it's nurse to manage, then it's our responsibility to try to get that Foley catheter out of the patient as soon as possible to avoid a infection. All right, next is skin. Their skin looks good, then you're gonna say skin intact. But especially for elderly patients, you wanna mention if there's any redness on the coccyx or if they have possibly any skin ulcers, because that's important for us to either be turning the patient often and or doing wound care. Also, you're gonna wanna explain if the patient had any incisions. So say if they had like a thoracentesis, You'll explain where that is on the patient's body and how it looks, if it's draining or leaking. Next is musculoskeletal, right here. This is where you would explain if the patient is ambulatory, if they're weak. This is very important to explain if the patient needs to get up with assist or not, because you would not want your patient to get up without anyone helping them. They're too weak and then they fall. So make sure you say, okay, the patient is up with assist, one person assist, or though the patient's bed rest, the patient does not get up, the patient is too weak to even get out of bed. This is also usually where I'll share if the patient's getting physical therapy or not, and how far they've walked or what they've done with the physical therapist. Next is drains. I usually don't have a lot of patients with drains, but this would be if they had a surgery and there's like a chest tube or a JP drain. You want to say where it is on the patient, what it was for, when those were put in, how much output you're getting from those drains, so what color, or just describing the characteristics of the fluid coming out into that drain. Last on the assessment area is going to be IV and IV fluids, central lines, and over here is VTE, which is like stroke precautions. So for the IV site, you're going to say, okay, so the patient has a 22 gauge right wrist saline locked. Or if the patient's getting fluids currently, you're gonna say the patient has a 22 gauge right wrist and they're getting normal saline at 100 mLs per hour in that right wrist. And then for central line, just important to mention this because central lines are a huge risk for infection. So you're gonna wanna say where the central line is on the patient. And then VTE would be if the patient has sequential compression devices on their legs, or if they're getting Lovenox or heparin or something that's going to prevent clot from happening while they're in the hospital. Okay, then over here I go into surgery and procedures. So this is where I'm going to say any tests or scans that have been done for the patient while they've been in the hospital. Chest x-rays, MRIs, and then you're going to say the results of it. So if the patient came in for a stroke, you're going to say CT of the head and MRI of the brain showed a stroke in the right wherever in the brain or whatnot. Also, if there's any repeat scans that are going to happen as well. And some nurses don't really bother too much for this area. They say, oh, it's okay, I can look in the chart. But other nurses want to know everything about those scans. So just make sure you have it ready. This section right here for me is like almost always filled. I just try to include everything. Also, if they had any surgeries, you're gonna wanna say what date, what surgery it was, how the surgery went, who the surgeon was. Then I go into labs, so if the labs were all good, and I'm gonna say labs are good, but I always write down the labs here when I first get onto my shift. And I also write any previous labs to see how those labs are trending. What happens a lot is like, say the potassium was low and we're a cardiac floor. So I'll say, okay, the patient's potassium today was 3.3. So I went ahead and gave the PRN, I would say it was 40 MEQs IV, or kind of just the form of it. Then underneath that is AccuCheck. So blood sugars, how high their sugar was, if blood sugars were ordered, and then how much insulin you had to give the patient. Lastly, over here is pain management and antibiotics. You want to say, okay, this is important to know as well coming onto your shift. The patient is in a lot of pain. They say 10 out of 10 pain, and the patient gets IV Dilaudid every 4 hours, or the patient gets Percocet, the last time I gave it was this time. So the nurse knows, okay, I'm gonna need to give the next Percocet around this time if the patient asks for it. And then antibiotics, just say which antibiotics the patient's getting if they are getting it. Also, if there's a urine culture that was positive, you'll say the bacteria that was in it and then which antibiotic they're getting for that. The very last section on this is anticipated needs discharge plan. So this is where you would say, okay, so when I look through the doctor's notes or I talk to case management, the patient is most likely going to be going to a skilled nursing facility. Other options would be home health, or the patient's just gonna go home. They're fully able to take care of themselves. So yeah, that's kind of just a gist of the report that I give. It's super nice to have a report sheet that works for you. You can always tweak it a little bit, and you're gonna learn with time, like I said, what works for you, what doesn't. It's been helpful for me to have something just to follow in the order of it. I've noticed that some nurses can really hyper focus on some parts of the report and get into a lot of detail about that and ask you a lot of questions. So if you don't know something, it's okay. Maybe you had like a really busy shift and you didn't have the time to go and look in the chart and see, you didn't get to look at the results of that CT scan or some scan that's not extremely important for that patient's diagnosis. You can just say, you know what, I'm so sorry. Actually, you don't even really need to say you're so sorry. Just say, you know what, I had a really busy shift. I didn't have the time to look into it, so sorry about that. You'll get better with it with time. It's not something that's easy. You might feel really anxious about it. Like the end of your shift is the most stressful part because you don't want to sound dumb. You don't want to give a report that sounds like you don't know anything about the patient, because you probably know a lot, but you're just tripping over your words because you're nervous and you know this nurse has been here for so long and is a really good nurse. So all of this is totally normal, and that's also why I wanted to make this video, because I just want people to feel like they can relate. If they went through a hard time mastering a report, then I can relate to you. I know what it feels like, but it does get better with time. I think that everyone will find a way to give their own unique report. And yeah, thanks for watching. I hope you liked it. I hope I could help. I hope I could give some tips on how to give reports. If you liked this video, go ahead and like the video down below and subscribe to my channel. I will be posting more. I'm so sorry this one took longer. It's just so hard with work sometimes, but stay tuned for the next video. Bye.